11 states are currently monitoring 41 Americans who may have been exposed to a rare pathogen. None of them have tested positive for an active disease, yet all are bound to a strict 42-day surveillance countdown. One of those individuals is Dr. Stephen Kornfeld, an Oregon oncologist. While traveling on a luxury expedition ship in the South Atlantic, Kornfeld stepped forward to treat passengers who were dying from a mysterious respiratory illness. After returning a faintly positive rapid test at sea, Kornfeld met a high-stakes biosecurity mobilization. Upon landing in the United States, he was transported to a high-security biocontainment unit for observation. The decision to track dozens of asymptomatic people across state lines indicates that health officials are managing a threat level that exceeds standard respiratory protocols. The pathogen in question is the Andes strain of Hantavirus, which is native to the remote forests of southern Argentina and Chile. In its natural habitat, the virus is difficult to contract. Human infection typically requires the direct inhalation of aerosolized rodent waste, particles that are usually broken down quickly by open-air wind currents and ultraviolet light. This raises a complex scientific question. How did a virus that is normally trapped by the geography of the wilderness manage to bypass its natural biological barriers and trigger a multi-state quarantine in the United States? The answer is found in the physical architecture of the MV Hondius. Operating in sub-zero Antarctic climates, the ship functioned as a sealed microclimate where passengers remained indoors for long periods. While the open air dilutes viral particles, shared indoor spaces concentrate them. Inside the ship, those microscopic particles were trapped within the vessel's insulated superstructure. Recirculating HVAC systems and communal dining areas effectively bypassed the virus's typical transmission barriers. Air was pulled from cabins and cycled through share spaces, keeping viral loads high. These conditions created a rare opportunity for human-to-human transmission chains, a phenomenon that almost never occurs in the open environments where the virus is endemic. By removing the natural dilution of the wind, the ship's environmental engineering acted as a biological amplifier, allowing the virus to spread from person to person. The official CDC stance, led by Acting Director Dr. Jay Bhattacharya, is that the Andes virus is not highly contagious. They argue that historical data shows transmission requires prolonged, direct physical contact, meaning the risk to the general public is low. However, independent researchers have expressed caution. They argue that official guidelines may be downplaying how the virus behaves once it enters a closed, recirculating environment. A major concern is the superspreader dynamic. In some outbreaks, a small number of infected individuals are responsible for the vast majority of secondary cases, likely due to high viral shedding or specific environmental factors. Because doctors cannot identify a superspreader until after they have already transmitted the virus, public health agencies are forced to treat every exposed passenger as a high-level threat. Because the virus has a long incubation window, health departments must perform twice-daily active monitoring for 6 straight weeks. Verifying each individual in person is a resource-intensive protocol that places significant strain on municipal budgets. Current federal leadership, including HHS Secretary Robert F. Kennedy Jr., has advocated for a model based on voluntary home isolation. They argue that localized, non-coercive monitoring preserves civil liberties while protecting the public. Critics in the Senate argue the opposite. They contend that by reducing federal port health and inspection teams, the government has created gaps at international borders, leaving the heavy lifting of biosecurity to underfunded state agencies. This is more than a medical debate. It's a fundamental disagreement over whether biosecurity should be a centralized federal command or a decentralized local responsibility. This 11-state surveillance dragnet has become a high-stakes stress test for the nation's heavily decentralized public health infrastructure. The MV Hondius outbreak will likely change how expedition ships are built. Industry experts predict a shift away from simple air recirculation toward advanced HEPA and UVC filtration systems for vessels operating in cold climates. The incident also created an international legal crisis. When Cape Verde refused to let the ship dock, the vessel was forced to head for Tenerife, sparking a debate over maritime obligations. This highlights the tension between a nation's right to prevent a pathogen from crossing its borders and the international duty to provide humanitarian aid to a ship in distress. As global travel becomes more interconnected, this incident will serve as a legal precedent for how sovereign ports handle vessels carrying high-consequence pathogens. The 42-day surveillance window for the American passengers will close in late May 2026. If the window closes with 0 domestic cases, it will validate the current model of localized, voluntary quarantine. If secondary transmission occurs, it will likely lead to calls for a return to compulsory federal quarantine powers. As we watch the final days of this 42-day surveillance window close, we are left with a fundamental question about the future of global biosecurity. Where should the line be drawn between centralized federal mandates, such as mandatory port quarantines, and a decentralized model that relies on local health departments and voluntary compliance? Which approach do you believe is more sustainable for handling emerging pathogens in an interconnected world? Join the discussion below with your thoughts on the balance between national biosecurity and localized administration. Insight through evidence, depth through detail. Thank you for watching. We will see you in the next investigation as we continue to track the global shifts of 2026. Universal News Frontier, monitoring the architecture of a changing world. Stay informed, stay curious.
An investment in knowledge pays the best interest, so why not invest in this channel? Click like and subscribe for more.